Bicortical and
Yes.
alag-alag.
So basically, two designs. Basically, two designs. Each will put different names. One is basal, and another one is compression. Compression is nothing but the threads are compression threads. They compress the bone. So one name is BCS,
Yes.
bicortical screws. Another name is KOS. KOS means King of Single Piece Implant.
Okay.
So Simpladent brand. The name of Simpladent brand, they are telling us BCS implants and KOS implants. Bioline implant, they are telling it is basal and compression. Grid also, they are telling the same name. And whatever company in the markets, they will tell similar terms.
No confusion that here is BCS.
Okay. That's all I'm saying.
So names are different.
Yes. So this is rough surface. This is smooth surface.
This is like a cluster.
Yes.
Treated surface.
Yes. It is similar to conventional implant. When bone is good, you place it. When there is no buccal bone defect, infected area, place a smooth surface. Okay. And there is one variation in KOS. There is something called KOS micro. You come on.
Yes.
There is something KOS micro. Have you? Okay. So it's nothing but this is the rough surface, same rough surface, but only 3 threads they are smooth. Only the 3 threads they are smooth. So even if there is some bone defect, since smooth surface is there, it will prevent periimplantitis. That is called KOS micro. Some micro threads are there, which are polished and smooth. Micro threads. That is also there. And just I will add some more confusion. There is something called BCS EX. So same BCS and EX. This company only Simpladent is having. Bioline doesn't have it. There is one more company from Bangalore. What is the name? Okay, have you heard about Mouth Implants? No. So they are having the BCS implant similar implant, and they are having basal compression design also. So what is BCS EX is? BCS EX alone. So what is BCS EX implant is? This is compression implants, no? This is compression implants. So what they did is they removed the middle part, okay, and it is replaced by wide basal threads. Okay, it is basically a compressive design, but the middle part you got big threads and it is fully smooth. So this will get more stability, So it is fully smooth, the first point. And here and here it is compressive design. In the middle, it is a basal threads. You can feel the sharpness. This is EX. Yes. Why it is called EX means extraction socket. It works better. Anywhere you can use it. Okay.
Transosseous B comes in the basal one.
Transosseous. Yes. Transosseous.
But they are not used.
Yes.
Now
They're outdated.
Interesting question.
So totally basal or BCS
compression of chaos.
So we should know the diameters and the length. Okay. So basal is diameter. Common diameter is 3.6. 4.6 is there, but we are not using. Straight away we can go 5.5. Have you seen the 5.5, the wide one?
Yes.
Okay. Okay, all company this diameter is the same. Okay, in compression screws 3.5. Okay, if you I will tell Bioline first. 3 mm is there, 3.3 is there, 3.75 is there, 4.2 is there. Okay, when it comes to Simpladent, it is 3, 3.2, 3.7 and 4. Don't get confused. Okay. Okay. The most commonly used is this range. One diameter below 4 and one diameter above 4 is the commonly used. If you are going for Bioline, what we used for the anterior, no, it is 3.75. Right? If the ridge is more wider, use 4.2. That's it. If the ridge is very very thin, select something from here. So there are 3 categories. Very wide, go for 4.2. Thin ridges, 3.75. Very very thin ridges, go for 3.3. More than 4.2 also available. 5 also available, but no need. That much big is that visible. So only in these 3 categories. Radius also available, right? Radius is 3.5, 4. That's it. Only 2 diameter, very simple.
And lengths vary from 6 to
Length I will tell. Okay.
Yes.
So length, first I will tell with the basal. 10. So 10 means
From
here to here.
Yes.
So if the bone height is 8, you can place 10 mm.
Okay.
Soft tissue 2 mm. 10, 12, 14, 17, 20, 23, 26, 29 also it goes because to reach the basal bone. But more than 23 is not needed. Only this is especially for upper anterior, lower anterior, very commonly you can use. Lower anterior placement is a commonly faced situation. Lower 4 teeth mobile. These 2 are excellently useful for lower anteriors. 7 and 20 are useful for upper one. In all companies, this diameter, this length is same, both Bioline and Simpladent. Compression length, Bioline. Okay. Previously, 8 was 8 from it will start from 8, 10, 12, 15. This is from Simpladent. Okay. And recently they added 6 also. Very the nerve is very much superficial. Okay. So the problem with Simpladent compressor is it is only available till 15. If you need more length, it is not possible, you know. Yes. So in Bioline they are having 8, 10, 12, 8, 10, 11.5, 13, 16, 18, 20, even above 20 is there, but till 20. So the good thing about Bioline compressive implants is they are having 18 and 20. So more, if the bone length is more, you can use that one. So to make things simple,
सिस्टम पूरा उसका ये जो कॉमनली दूसरों को शायद यूज नहीं हो सकता.
okay.
ऐसा है सर, पता नहीं. Simpladent कंपनी मतलब
It's asking if the same kit not
you can use. That we are using. What components we have used? No, they are Simpladent. Okay. The drill is Simpladent, the carrier is Simpladent. But lower jaw we used radius implant. The previous case, the lower jaw is fully radius implant. You can interchange it. I told one company, in mono implant Bangalore, that company implant you cannot interchange with this component. Okay. So all the 3 companies, radius, Simpladent and Bioline, you can interchange. That is a good thing about this. Handle, carrier, anything you can interchange.
Sir, in conventional you can use for
Yes, you can mix and match. You can place 2 implant conventional and you can place this one.
the kit can use the
Drills you can use, but other things you cannot use.
other things mean
Carriers, ratchet and all.
ratchet.
Yes.
Separate kits is available now.
Yes, separate kits available.
सर हाउ मच
Carrier. This is implant carrier. You It will differ because it will go into the implant. Here it goes into the abutment. So this is the abutment. If you see, you can see 3 projections. Here you got 3 grooves. So almost all the company they have got these 3 grooves. So it will fit. Okay. So when you move it, it will also move. So this is the ratchet.
It's also different.
Yes. Same. So this is Simpladent carry ratchet, but you can use it for either
Either of these.
either of them. So the handle for maxilla it will be very much useful. Here also you can see the 3 projections. It will go on fit here, and you can. And this handle is interchangeable.
Yes.
Okay. This is Simpladent.
Interchangeable means both the sides are different.
No, there are 2 type of this handle is available.
Okay.
Another in Simpladent. The thing is in Simpladent there is 2 abutment designs are available.
Okay.
This is regular abutment, and one more abutment it will be very thin. If the mesodistal space is very thin, it is also available. Previously they used to sell only this abutment, small abutment. This is called small abutment. But the problem is the retention is small. So slowly this design went out of date. I will show it. 5.5 something small it. So for that you need a separate handle. To keep things simple, now they are providing everything with regular heading. So this is Simpladent. The Simpladent drills, their handles, carries, ratchets, everything, they are very excellent compared to any other company. They come for long life. So this is Simpladent carry ratchet. Okay, this is Simpladent handle. So to insert the